to be addressed by those in the room. We also have a number of questions which have been submitted by members of the public in advance, and where possible, I will try and address those as well during the questions, although we will not necessarily be able to answer every individual question posed either previously or during the session. Tonight's format will be a short presentation followed by a panel discussion. Our panel this evening is Councillor Julian Bell, the leader of Ealing Council, Councillor Binda Rai, the Cabinet Member for Health and Adult Services at the Council, Paul Nazarek, the Chief Executive of the Council, Anna Bryden, the Council's Director of Public Health, and Dr. Deborah Turbett, Deputy Director for Health Protection for London at Public Health England. We are also joined by a number of senior NHS colleagues who will be available, if required, to address questions on the NHS response. I'll introduce those if we need to call on their expertise during the Q&A session. Your democratic representatives, ward councillors, MPs, assembly members have received briefings, and I know many of them may also be watching online or in the audience. I hope that's clear on the format. I'm now going to ask Anna Bryden, the Council's Director of Public Health, to unmute, and I will share her screen and give a short presentation on the facts as we know them. Thank you.
Thank you, Kieran. Good evening, everybody. I'm going to share my screen and turn off my video just for IT reasons. So just bear with me for 1 second. Okay, can we see that, Kieran?
Yes, we can. Please go ahead, Anna.
Yeah. All right. Thank you. I wanted to provide some information, some reassurance, help answer questions, and go through information that people might not have seen. I'm sure a lot of people on the call will have been looking at the website, the social media communications, and things in the national media. I'm sure some people won't have seen a lot, so this is really just to provide some of that information, and hopefully that will help provide some reassurance and some clarity on the situation. So I'm going to run through what's happening currently, some more information on South African variant, discussions about the local area that we're looking at, how somebody will get a test through this initiative, and some key messages. So really looking at the situation in the UK as a whole. So all viruses change over time and new variants or types emerge. We found a new variant of this was found in South Africa back in late 2019. And in the UK, everybody that takes for COVID, 5% of those tests are randomly chosen, and some analysis done to see which variant they have. Through that analysis of the 5% of tests, around 100 people in the UK have been found to have the South African variant. Almost everybody out of that 100 have had direct links to South Africa, for example, through recent travel there. However, a small number have been found where they can't identify any links to South Africa. So there is some transmission within communities in the UK as a whole. So looking at the situation in Ealing, through that 5% random sample, there was one individual local area in W7 who was identified as having had the variant, but without any direct links to South Africa. So obviously I'm not sure how that person was infected with the variant, but likely through community transmission. That person tested positive at the end of December, so obviously a little while ago. It's just because the time it takes to do the analysis on the variant takes little time. And so we were only informed a few days ago of this case. Really positively, that person followed all the rules, self-isolated well, so no concerns there. That person is one of 11 who are identified in 8 different areas across England. The initiative we're talking about tonight is being nationally led, and we are supporting that initiative at a local level. So one thing I want to say here is that there is no specific concern or indication that this area in Ealing, or Ealing as a borough, has a higher prevalence of this variant than anywhere else. It just happens to be that this person tested positive and was picked up through that random sample. There is an understanding nationally that there will be other cases out there in the country. And so because only these 11 have been identified, Public Health England and the national government are really keen that we do some additional testing in these local areas for two purposes. The first is really to help identify anybody else who might have this South African variant and help control the spread of this variant as much as possible. And the second is really to help us understand how that variant is spreading and protect our communities. Obviously, we've only got 11 cases that have been identified in the UK, really small number, it's really early days, but we understand that the variant is in their communities. But we need to do some information more understand how it's spreading within the UK. So that's what the national government is asking us to help with locally. Wanted to just point out two different types of testing. If anybody in the areas we're talking about, and I will come on to that in a minute, if anybody has COVID symptoms, so a high temperature, cough, loss of sense of smell or taste, we do ask them to self-isolate as normal and get tested through the normal routes, which I'll share with you in a minute. Importantly, any testing in Ealing at the moment, because they've got symptoms, all of those samples will be sent to the specialist to identify the variant, rather than just 5%. So that will really give us a lot of information that we need to understand how the variant's spreading and how we can protect our communities better. For people without any COVID symptoms, this is the initiative that we're really talking about tonight. National government is asking us to offer testing to around 10,000 people in the local area who live or work in parts of the W7, W13 postcode areas, and I'll share those in a minute. And really importantly, to help control the virus and protect our communities, we are asking that anybody who tests positive using any kind of COVID-19 test does then need to self-isolate for 10 days. Information about the variant, obviously there's a lot of media about this, and really want to be clear on what reassurance we can provide here. It was identified in late 2019. We don't have that many cases in the UK, so most of our understanding is from what happened in South Africa. Just wanted to answer a few basic questions that I'm sure people will have. Are the symptoms the same with this variant as well as any of the UK variants? Yes, absolutely the same symptoms: high temperature, cough, or loss of a sense of smell or taste. How quickly does it spread? So compared to what we call the original variant in the UK that's been out there for a few months now, it does spread more quickly, but that's very similar to the new UK variant that be widespread in London nowadays. So it spreads as quickly as that one. Does it make people more ill? No. There's absolutely no evidence that this causes more severe disease, higher number of people going into hospital, or a higher number of deaths. Absolutely the same as the others. And really importantly at the moment, as we've got such a big push on people to get the COVID vaccine, there is no evidence that the vaccines don't provide protection against this variant. I think that's a really important point. So just to share the map of the area, this is available on our website. What the national government has done is really just looked at a local community that lives around where the individual was identified with this variant, and just asked us to take 10,000 tests really as a ballpark figure to give us enough meaningful data coming out of this that we can really understand what's happening locally. And this is the same in the other boroughs. I totally appreciate the map isn't necessarily drawing neat lines around areas that you know, but it's the postcodes that we are focusing on. So the postcodes are down on the left. You can see the map on the right. The two lines going across horizontally are the train line and the Uxbridge Road. So this covers parts of Hanwell and parts of West Ealing. One thing I do want to say really importantly here is these are the people in these postcodes that we're asking to get a test. If somebody lives just slightly outside the area or isn't quite sure if they're within the map, absolutely you can come and get a test at the testing unit. Nobody's going to be stopped, but we are asking to focus on these areas as they are the areas of interest for the government test programme. Eligibility is either people who live or work in these areas, and we are looking at how we can support local employers testing kits as well. So just going back to those two types of testing options, if anybody has symptoms of COVID-19, we ask them to self-isolate and book a test through the normal route. So that's the government website, that goes on National Portal, where you can book a test at a number of testing sites, 119. If anyone doesn't have any symptoms of COVID and isn't currently self-isolating, we really do ask that you please take part in the enhanced testing. It will really help us understand what's going on here and in the longer term help to protect our communities. So they're done in two ways, and I'll just go through them briefly now. The first is that every residential address will be visited and handing out home testing kits. And the second is that we've got a specialist testing site at Dean Gardens car park. So looking first at the home testing kits, I've just put a picture there so you can see what they look like. The council just today started visiting every residential address in this area, and we'll be doing that over the next week or so. We have home testing kits that are boxed up, handed out to adults in the household, anybody 16 and over. And then another team will follow 2 hours later and will pick them up. So please don't put them in the post because they won't get to the specialist lab. Just hand them back to somebody 2 hours later. At the moment, if someone isn't home, we are putting a letter through the door and giving information about how to book at the testing site, because we understand that obviously a lot of people might be out for work. Just to give some reassurance to people that are coming and knocking on doors, they've got a special ID badge with the council logo and their name on it, and a photo. They're wearing standard protective equipment, so gloves, an apron and a mask. The dates and the areas that that group is planning to visit, the date are up on our website. And just wanted to say we only started today, but they'd already visited almost 1,000 homes so far, and really getting a lot of interest and positive feedback there. So the second option is this specialist testing site at Dean Gardens car park. That's open at the moment between 8 and 3. And that's really especially for people to be out and about for work. Obviously, we're still following the national lockdown restrictions. So if somebody's already staying at home, for example, if they're shielding, we don't ask you to come out. We are asking you to stay home as normal and wait for the home testing kit to arrive. But for anybody who does need to be out and about for work, or anybody who comes into the area to do work, we would ask you to book a slot at the testing site. We've had almost 800 people tested through there so far. We are absolutely aware that there were issues on the first day with capacity there, and with the booking site getting booked up very quickly. And we did have a much bigger site today, and we are working closely with our regional colleagues to ensure that that carries on. But slots will become available as they come up on the booking site. So we do ask people to book rather than turn up. Just a couple of points about the test itself. For those that are interested, this is what's called a PCR test, which is the gold standard test. It's a swab that you put into your nostrils and your throat and then back into the kit. And that then gets handed back or collected by the people at the testing site, and you will receive results 3 days later. That will tell you at that stage whether you are positive or negative for coronavirus. And if you do have a positive result, you will need to self-isolate for 10 days. As per usual, if anybody tests positive for COVID, the Test and Trace service will be in touch to ask about anybody you've had close contact with recently, and they will also be asked to self-isolate. What's different about this testing result is that that result then goes off to the specialist lab to have a look at what variant somebody might have. That takes a little bit of time. If somebody is found to have the South African variant, you will be contacted a couple of weeks later to let you know. You might be asked some additional questions, protect other people, but you don't need to take any further action. So nobody's going to ask you to go back into self-isolation at that stage. That will be finished. So really just to finish off with key messages, please continue to follow the current national lockdown restrictions. So stay at home as much as possible, only go out if it's essential. Continue to protect yourself and others. So washing your hands, using a mask when you're out and about, and carrying on with social distancing. We would ask please that you take a test through this. It's not mandatory, but we really would encourage people to do this. It will really help us understand what's happening with this variant. If you test positive, you do have to isolate for 10 days to stop the spread of the virus. But really importantly, support is available on that. So for people, for example, on benefits or people that need some practical support, there's the Ealing Together website there or a phone number. And really importantly as well, as we said, the vaccines still do protect against this variant, and it's really important at this stage in the pandemic that everybody takes up invites for vaccine appointments. You will receive an invitation from the NHS when you're eligible, so no need to call anybody. But if you do receive that, we would encourage you to go. And importantly, there is no stage. We are not in any form of local lockdown. We are just following the normal national restrictions. So businesses, etc., are to remain functioning as they currently are. We're not asking nurseries to close, anything like that. So just carry on doing what you're doing. The only additional request is to take a test. A lot more details and questions on the website. And that's all. So I'll hand back to Erin. Thank you.
Okay, thank you, Anna. I'm now going to ask to check Councillors Bell, Rye, Paul and Deborah that you've got your cameras on, and we'll endeavour to answer as many questions as we can. We've had a number coming in, and I will try and address them. A reminder that you can vote for the ones that you would like answered to help with that. And I will take them in groups of 2s or 3s. Anna, you did touch on this one, but I'm going to come to you and Deborah because it's the top question that has been voted, and it's from Randy Banks, which is about the target or affected area with the how was it drawn up, and the concern that it looks like an attempt at being too precise, I think is the feedback. And that question, or a version of it, how did the area get drawn up, and why does it cut off, for example, parts of streets, I think has been a consistent theme we've had in the questions received in advance. So perhaps if I'll come to Deborah first to clarify how it was drawn up, and then I'll come to Anna, perhaps to clarify what is the advice to residents who live perhaps just beyond the boundary. So if I can take those 2 points first, over to you, Deborah.
Thank you. As Anna said in her presentation, we want to understand whether there has been any further transmission of the virus in a local area, and a decision was made nationally to look at the area around where any of the 11 cases had been identified, and to pick a number of 10,000, which is a big enough number that we should, if there has been transmission, we should be able to find that in that group, and that size of group in the population. And so it was done based on postcodes, which allow us to target that number. And Anna may want to say more about exactly which postcodes were selected, but they were the postcodes immediately adjacent to where the person who was diagnosed with the South African variant lived or lives.
Thank you, Deborah. Over to you, Anna.
Thank you. So just to add to that, we've listed the postcodes, the maps in the slides, and is on the website. There's also a postcode checker on our website. So if anybody wants to go on there, put in their postcode and see if they are in the area. Like I said, if somebody lives just down the street that's cut in half on that map, we're not going to turn anybody away from the testing. really want to get as many tests done as we can. But if somebody lives a few streets away or in another part of the borough, we are saying at the moment you don't need to get a test as part of this. We really are looking at that local area. The only other thing I would add is there is no indication here that the person identified through the testing that he's some sort of patient zero that spread this in the community. It's almost the other way around, is we don't know where that individual would have got the infection from. We just know that it's in communities across the UK. And really, we have so many few of these cases that we know about in the UK. We're just looking at those local areas to try and help us understand this better. Thank you.
Okay, thank you, Anna. Perhaps are you able to comment on what is the advice for residents who live just outside of the affected area? And I'll also come to Councillor Rye, the Cabinet Member for Health and Adult Services on that point too.
Yeah, thank you, Kieran. So if anybody lives in an adjacent area, we would say you don't need to get a test as part of this initiative. We would ask you to carry on with the normal measures that you're already taking in terms of preventing COVID generally. Rates are still relatively high in London, and we have a long way to go before they're down to a level which feels a lot safer. So we are asking everybody to just abide by those restrictions and carry on with kind of hands, face, space messages. Thank you.
Councillor Rye, is there anything you wish to add to that?
I just think it's important to reinforce the point that this is a precautionary measure, and really the council has gone out of its way to organise this testing as quickly as possible, and obviously working very closely with the national bodies concerned. I don't think people should be alarmed about it. I think they should feel reassured that we are testing people just to make sure that, you know, it doesn't spread, and that's important. And again, as Anna said, the hands, face and space message is really important, as well as the asymptomatic testing. Please go and get those done.
Thank you. So I'm going to take a question which I can see one or two people have asked in the chat, but we also had a lot of questions in advance, which were, was the affected area subject to any additional lockdown measures? So are there tighter restrictions that residents who live in these postcodes must follow, which I know was a source of some concern. So I think, Councillor Bell, I'll come to you on that point, and I'll just also tee up the next question, which is one which has got a lot of votes in the chat function here, which is from Matthew Skinner, which is about what the council is able to do to make available this testing for people who may be homeless or rough sleeping in the affected area, and particularly vulnerable. And I think, Matthew, you've posted a number of questions to that effect, also considering the St Mungo's outreach teams or the YMCA. So I perhaps come to Anna on that one next. So Councillor Bell, would you be able to comment on the rules which are in place for residents in the affected area?
Thank you, Chair, and good evening, everybody. So I think there's been a little bit of confusion from the Secretary of State saying to people, you must stay at home and wait till you get the home testing kit and don't leave home, without clarifying probably fully that actually the national lockdown rules are the rules that still apply in this area, in the W7, W13 areas that have been chosen. I would say that they were chosen on the basis of super output areas, which are subdivisions within wards. And they're used for census purposes, but so in that sense they are slightly arbitrary. It was to get to the 10,000, but anybody within that area they follow the national lockdown rules. Now, clearly, there's got to be an element of common sense and caution, I think. So, if I was living in that area, I would be probably more cautious about going out for essential purposes to get food, etc. And that's what we're saying. If you're out and about because of your work, go and get a test at Dean's Gardens, but otherwise wait and stay at home. But the lockdown rules, as they apply to everybody across the borough, apply in this W7, W13 area as well.
Thank you, Councillor. Over to you, Anna.
Thank you. Thank you for the question about how we can support more vulnerable populations. I think it's a really important one. We have been engaging with a lot of local employers, a lot of businesses, a lot of community groups about how we might be able to support them to get tests. I haven't had any specific questions from, for example, St Mungo's, but I know we will have been engaging with them as part of our communications. So I think it's definitely something we want to pick up, support all populations to get the tests. Anybody who is in that area can go to the testing site, but we appreciate that's difficult for a lot of people, or they might not be wanting to go there. So we do need to go out and about to some communities, try and reach as many people as we can. So we will take away that specific link, and thank you for the information.
Okay, thank you. The next two questions I'm going to take, there's one from Val Simon, who's asking, the council, Ealing has amongst London's highest COVID rates. Has the council's work on LTNs meant the council has taken its eye off the ball in the response? I think that's a political one, which I'll direct to Councillor Bell. And then there are a number of questions in the chat about aspects of the home testing delivery. Common themes include when will the testers arrive at my home? How long will it be until that my test is collected? So I think they're the two questions. So I'll come to Paul, I think, in the first instance, then just to perhaps offer some remarks on how that home delivery of testing is occurring. But first, I will come to Councillor Bell on the overall question about the council's response to COVID-19.
Yeah, thank you, Kieran. So in terms of the COVID rates that we've had in Ealing, they have fluctuated and they've gone up and down. In the last probably 2 months, we've been at one stage when this new Kent variant was kind of coming into London through the eastern boroughs. We were for quite some considerable period around 28th, 29th in the league table in numbers of cases. And then as that wave moved across the city, we increased, and in the last month we started to go up, and currently we're second highest as cases overall have started to come down. So I think one of the things that we've discussed as leaders of all of the boroughs is that it was important that London stuck together and tried to react and fight COVID as a city together, because it may be Richmond with high rates one day, and then the next in a week's or so's time it's Redbridge or Bexley or Wandsworth or wherever. So I think we are subject to waves in terms of infections, and it's very hard to predict how things will spread and develop. obviously there are key things that we can do in response, and we've talked about the hands, face, space, and that advice to people to stay at home and to work from home and to not go out. All of those things do have a key effect in terms of bringing case rates down. Now, one of the things that in the early days after the first wave, when the lockdown was beginning to first lockdown was beginning to be released, there was a fear that with reduced capacity on public transport, buses and tubes and trains, because of the need to social distance on public transport, that there would be a kind of car-led recovery in terms of everybody jumping into their cars, having previously gone on public transport. So the low traffic neighbourhoods was a response to that in order to try to encourage walking and cycling more. And clearly, we had seen the benefits of actually more cycling and walking during that first lockdown. Now, we're in the middle of the experimental traffic orders on low traffic neighbourhoods. We've listened to what people have said in terms of concerns about access for emergency vehicles, and we've made concessions for people with blue badges to be able to go through the barriers. We've taken the bollards out and replaced them with cameras so that emergency vehicles can get through. We've also given an exemption for NHS staff who are delivering vaccines against the virus to homebound residents, so that they can go through the barriers and get those vital vaccines out to our homebound residents. So, we are listening to what people are saying, and clearly.
I don't know if it's just me, but I've lost Councillor Bell's reception. I can see other panellists are nodding, so I suspect that's the case for others. What I'm going to do is go to Paul to respond to the questions on the rollout of home testing, and hopefully Councillor Bell's connection will improve and we can come back to pick up his remarks. So Paul, over to you.
Thank you, Kieran, and thank you for the question. So the home testing works as follows. We have 2 teams of home testers that will be fanning out through the streets of these 2 postcodes. That they start, you'll be aware that Dean Gardens is in the east of the area concerned, of the Hanwell and West Ealing area. And what we are doing is we started today in the west of the area concerned, in the northwest and the southwest, in those streets. And we are gradually moving west to east over the next few days to visit every house in the vicinity of these postcodes affected. So you can also look on the council's website, where you'll see the map that Anna put up earlier during her presentation. And on that map, it will indicate which streets and groups of streets are being visited precisely on which day. And our goal each day is to visit just over about 1,100 houses per day. And we hope to have finished all of the home visiting by next Tuesday. So really over the next 6 days or so, we're carrying out that work. If we can get through it earlier, we absolutely will. In terms of how it works, a member of staff will knock on the door. That person will have clear identification, an ID badge that will have the council logo, an NHS logo and their name on it, and they should show that to you. And they will ask you really only one piece of information. They'll ask you how many people over 16 there are in the household, and they will leave you with as many tests as there are people who are over 16. And for those who are worried about security, they will not ask you for your ID. They will not ask you for proof. There will be no financial questions asked. So, you know, none of those issues will be covered by people. They only want to know how many people live there, and they'll leave you with the right number of boxes and test kits. And then what will happen 2 hours later or thereabouts, a same member or a different member of the team will knock back on the door again, and they will pick up the test kits from you. Hopefully you will have taken the tests by then. There's clear information with the tests, and you can hand those back to the person, and they'll then go off directly to the lab in the way that Anna described earlier. And really pleased, as I think Anna said earlier, that as of 6 o'clock this evening on our first day, we've already done nearly 1,000 of those home deliveries. So our approach seems to be working and has been well received on the doorstep. Thank you, Kieran.
Thank you, Paul. Julian, I can see you're back with us, which is good. Were there any final comments you wanted to make on the points you were making?
I'm not sure what you heard and what you didn't hear, but basically I'd got to the point where I was basically saying the safety of our residents was first and foremost in terms of protecting against coronavirus, but also ensuring that our emergency services could get through low traffic neighbourhoods. And you know, clearly the rates of COVID go through. We've had waves, and we've gone up and we've gone down, and yeah, we need to adjust to the lack of capacity on public transport because of social distancing, and that's meant we've used experimental traffic orders to introduce low traffic neighbourhoods to try and encourage walking and cycling.
Thank you, Councillor Bell. I'm going to go back to the Q&A box because a number of questions have got a bit of popularity. So there's a couple from Helen Smethurst which seem to resonate with others on the call. The first, which I think is perhaps one in the first instance, Deborah, you may wish to offer a view from a national perspective on, is what measures will be taken in the event that a large number of cases of the new variant are found? Would that lead to a national lockdown? And a lot of people clearly would like to know that. A second question, also from Helen, which is very popular, is what is the rationale for the testing being for adults over 16s? Why not include children? So perhaps, Deborah, I could ask you to take those two questions, but then there's also a question from Gull Greenslade, which is popular, which I won't read it all out because it's quite long, but essentially the gist of Gull's question is that not enough people in the West Ealing area are wearing a mask, particularly when they go to the supermarket. And is there more that the council could or should be doing to issue fines on that matter, in the same way perhaps as on littering? So I'll come to both Councillor Bell and the Chief Executive Paul on that one after we've heard from Deborah on the national questions, if that's okay.
Absolutely. So obviously, to date, we've only found a very small number of cases around the country of the South African variant, and the government banned flights from South Africa on the 23rd of December 2020 when we were aware of the virus circulating and that it was a new variant in Southern Africa. So we're protecting the population by protecting further people coming in from Southern Africa. Anybody who does arrive because they're a UK national or UK resident is required from arrival to go straight home and self-isolate, and they are all given a test within the first 10 days. I think it's on day 8 that they're asked to take a test, and they're not allowed out of self-isolation until they're tested negative. Obviously, if they test positive, they do the full 10 days of self-isolation. So that's what we're doing at a national level to protect our population from more introductions of the virus. We found this very small number, and it may be that people have come in via other countries, having been to South Africa and caught the virus. So we have picked up this very small number. What we want to do is understand whether there are other people in local communities who've also caught the virus from those very few introductions that there must have been. And what we will do is, if we find further people with it, we will ensure that they self-isolate, their household contacts also isolate, and we will test the household contacts. So it's really an effort to try and stamp out the virus and eliminate it at an early stage. Obviously, if there has been much more widespread transmission than we think there has at the moment, the government will take a view on what we then should do. But we're already in a national lockdown. We can't be in more of a national lockdown. It's possible that the government may want to put additional restrictions in if they see widespread transmission of a more transmissible virus, but they haven't indicated to us that they're thinking of putting in any additional measures, because as you will have seen in Ealing, as you've seen the rates come down since the beginning of January, when they were very high as they were in other parts of London, the restrictions that we're all following are actually working in Ealing. So the rates are coming down. So it's really important that people do follow those messages to stay at home unless you have to go out to work because you're a key worker or you cannot do your work from home. You can go out to shop, you can go out to have medical appointments, and if you're called for a vaccine, please do go and get the vaccine. But we should all be following the rules of what we need to do when we are outside the home. So wearing face coverings, hand sanitizing, washing your hands before you go out and when you come back in. Obviously wearing face coverings on public transport if you have to use it, and when you're in essential shops that are currently open.
Thank you, Deborah.
Happy to come in on the face covering in West Ealing, Chair. So clearly it is frustrating when those who are out and about are not wearing face coverings when they should be either on public transport or in shops and confined areas. And clearly we have, in response to this information about the South African variant being in the Hanwell West Ealing area, diverted our COVID marshals that we have to Hanwell and West Ealing to give those messages for people to wear face coverings and wash their hands with sanitizer and all of the things that we know about. Now, unfortunately, we don't have the powers in the way that we have for littering to enforce those rules in terms of face coverings and other things. And that is something that the police have got the enforcement powers. Now, I've seen figures today from our West area police authority, which covers our borough, Hillingdon and Hounslow, and they have increased the numbers of fixed penalty notices that they're giving out. Compared to the previous lockdowns, the police are much more robust and will move to give fixed penalty notices much quicker. That's right, and our teams that are out there, our Safer Communities teams, our COVID rangers are working very closely with our police partners to make sure that we do everything we can to get people to follow the rules.
Thank you, Councillor Bell. Paul, was there anything you wanted to add on the enforcement point?
I think Councillor Bell's covered it very well, Kieran. All I would add is that obviously we've been in liaison with the police directly about this initiative in these postcodes. And so the police, alongside our community safety officers, are focusing on this area as, in some detail, as well as other parts of the borough. And our community safety team do visit places like supermarkets and higher risk places for transmission on a regular basis to try and make sure that people are following the rules, and also to support the businesses and give them advice and support in how they can best help the public to stay within the rules. Thanks, Kieran.
Thank you, Paul. The next two rounds of questions I'm going to take. The first is on employment and volunteering. There are a lot of questions on a similar theme, all getting quite a bit of attention, and I know we received a number of these in advance. So I'll try and summarise, but we've got questions from Ciara about early years staff who are still going to work. Are they, even if they live outside, are they eligible? And that's a common theme. We also had questions submitted in advance. Are businesses whose staff live outside the area but come into the affected area for work eligible? So I would perhaps come to Anna on those questions about that. And another theme of questions, which is about whether employers should be requesting people who are not displaying symptoms who live in the affected area to have a positive test. So there's quite a lot there. So I'll come to Anna in the first instance to offer a policy view on employees and what the position is. Thank you, Anna.
Thank you, Kieran. Thank you for the questions. So we are already liaising with a number of employers in the local area, and that does include early years settings. If somebody works in the area, we are asking them to get a test. We do understand, though, that there are limitations on people working in the area if they can't get to the testing site. And so we are trying to look very rapid into options for getting some tests out to certain sites and certain employers so that they can have those tests. Please do bear with us. We are moving very quickly on this and doing what we can to get tests out to those settings. In terms of the other question about do people who either who live or work in the area need a negative test to return to work, the answer is no. We are asking that if anybody's going out and about for work at the moment, please do carry on do so. There's no need to not do that. If anybody is able to work from home, just please follow the national restrictions at the moment and do try and work from home, but nobody needs a negative test under this initiative before they can go back to work. Thank you.
Thank you, Anna. We've got a theme of questions, perhaps unsurprisingly, on the vaccine. So I think these might be ones which are best placed for Deborah from a national perspective. So I'll summarise the questions, but we're also, as I mentioned at the outset, joined by a number of NHS colleagues, one of whom is Dr. Mahini Palmer, who's a local GP, but also chair of the clinical commissioning group from the area. So after I've asked Deborah to comment on the vaccine efficacy questions, I'll come to Mahini for just an update on the vaccine rollout in the area, which I know a lot of people are interested. And Deborah, I think the gist of the questions is twofold. Is the vaccine effective? Are all vaccines equally effective, do we know, on the South African variant? And in particular, there's a question that Anna's presentation didn't mention the AstraZeneca vaccine. So is that because that's less effective, do we know? There's a set of questions about will the national policy on having the second dose 12 weeks rather than the originally proposed 3 or 4 weeks be changed as a result. So would you be in a position to comment, Deborah, on vaccine efficacy or vaccine rollout policy? And then I'll come to Dr. Palmer on the local logistics, if that's okay, and how we're doing.
Certainly. So there's no indication at all at the moment that the vaccines will not be effective against this variant. There are some changes in the formation of the virus, in what it in how it presents, but the vaccines that are currently being given to the population in the UK, currently to the over 70s and over 80s at the moment, and to health and social care staff, we believe will be effective and will protect against this variant, as they will protect against the UK variant, which was it. Then they currently do protect against the UK variant, which is different again to the virus that we had coming into the country last March. So we would encourage everybody who is offered a vaccine to take up that offer, because they do offer good protection. Not all vaccines have the same effectiveness. You will have heard in the news about some vaccines are 85% effective, 90% effective, 94% effective. That means that they're very good levels of efficacy when they're used in the population, and when sufficient people are vaccinated, that will protect, that will prevent the virus from spreading around in the population. That's the aim of offering the adult population the vaccine. What was the second question, Kieran? Remind me. Sorry, you're on mute.
Yes, apologies. I think the second theme of questions was whether the presence of the South African variant might change the policy on vaccine rollout.
So the policy on vaccine rollout was changed just after the vaccines were introduced, in order that we could offer as many doses, as many people as possible in the vulnerable groups and cohorts in older people as possible. Had we proceeded with giving the first dose and then a second dose 1 month later, we would have been able to vaccinate far fewer people. And there was good evidence from the AstraZeneca trials that actually giving the second dose at 12 weeks produced better immunity than giving it at a shorter interval. So in fact, we're going to be able to produce better immunity in a greater number of people more quickly by doing that, by using that policy. And so at the moment, I don't think the government are minded to change that, because that's a good plan to get as many people as possible in the adult population vaccinated, and that there shouldn't be any change to that policy as a result of a few cases of the South African variant being identified here.
Thank you. Dr. Palmer.
Thank you, Kieran. So just on the logistics for Ealing, I'd like to reassure the public on just some of the numbers that we've got, and I think people should be really quite reassured. So amongst our care home residents, we have vaccinated 88% of the population. People over the age of 80 is 76%. So that's not brilliant, but pretty good. 75 to 79, we've got 79%, and 70 to 74, we're hitting nearer 70%. So the numbers are good. In terms of logistics locally, there are really 4 pillars in how we are vaccinating the population. Firstly, the hospital trusts have obviously got their vaccinations hubs where they are vaccinating their staff and health and social care staff. You have got the 2 big primary care hubs in Ealing, one in the Dominion Centre in Southall and the other one on Ealing Town Hall, which is run by local GPs and are open 7 days a week, vaccinating exactly as Deborah said, the 1 to 4 JCVI groups at this point, and that's our focus till the middle of February. The other two things which are coming online shortly is one, the mass vaccination site, which has gone live on Tuesday, yesterday, which is in CP House, very much on the Uxbridge Road near Percival House, and that will ramp up eventually to be doing 1,000 vaccines a day. And also we've got pharmacy sites. We've got 4 ready in Ealing, which are open. 3 have gone live, and 1 is slightly delayed, and they will be coming on stream as well. So there's a multi-pronged approach to take this forward, and actually even looking at people like housebound, 70% of our housebound have been vaccinated by GPs and in their staff. We still have an element of vaccine hesitancy in certain cohorts of the population, which we are continuing to address. But I think it's important that when people do get the text to book your vaccination, please do go and book it as requested. Over back to you, Kieran.
Thank you, Dr. Palmer. I'm very conscious we're nearing the end of our time. There are a number of key questions that people are still asking. I'll just try as quickly as possible. There's a question that both Zeliof and Peter have asked, and which has got a lot of popularity, which is, when will we know the results of this exercise at a community level? So that might be one for Anna, yourself, and perhaps Deborah from a national perspective to comment on.
Looks like Anna can't get off mute. I think Anna did say during her presentation that people will get their individual results within 2 to 3 days if they take a test. That's as for all of the tests, people are getting those results. So they will get their tests through NHS Test and Trace, and that will be in the usual way, which is by text or email, depending on which option you prefer. And that will tell you whether you are positive or negative for COVID. And obviously, if you are positive, you will need to follow the requirements to self-isolate. It would also then require your household contacts, as usual, to self-isolate as well. Any positive tests that we detect as a result of this screening, we will then send them on for the genome testing to see if they are the South African variant or not. Now that's very specialized testing. It's not every laboratory that can do it. We've got a network of laboratories that are able to undertake that testing. So those tests will have to go there and be analyzed. And that can take anything up to 2 weeks. But we're putting processes in place to be able to feed back results to individuals that will tell you that you had the South African variant if you do test positive for that. So those results will be available about 2 weeks after the tests are taken. So it's going to take us another week or so to complete all of the testing. So it's likely to be about 3 weeks from now. And I think Anna and her colleagues will make arrangements to share that information at a community level so that we'll be able to say, as a result of the testing, of the 10,000 tests that were given out in Ealing, so many were returned, and this number were positive, and of that number that were positive, there were X that were the South African variant. I don't want to try and guess how many that might be.
Thank you, Deborah. I think the final theme of questions is kind of probably summed up by a question from Sally, which was about the way this news became public at a national level, and a view that it would have been ideal for local residents to have been informed before this was in the national media. There's a number of questions about communication and what the council's trying to do to make sure everybody is aware of the activity that's happening in their community. Councillor Rye, perhaps I could ask you to comment on how we've been communicating the activity and our goals. And then perhaps I will ask Anna if she can come off mute from a public health perspective. And finally, Councillor Bell, as the leader of the council, to kind of offer any closing messages that we would want to take residents away, because we did say we would finish close to 8:30, so we need to start wrapping up. So Councillor Rye, over to you.
Thank you, Kieran. In an ideal situation, it would have been really good if we could have shared the news with you in advance, but we're really constrained by national guidelines on when we can communicate. And I know that the Ealing Comms team worked throughout the weekend to get these messages sorted and to get all the different channels up and running. But we were embargoed by the National Centre, so we couldn't share the news with you earlier. What we did try to do was to make the information as clear as possible and to try and have a strategy in place locally so that we could share the news. You know, the outreach was as maximum as it possibly could be. And I would be the first to accept that maybe on the national news, again, which was outside our control, the fact that W7 postcode was used did cause a few anxieties amongst our residents. And I hope that this webinar has now helped to address some of those issues, and people are much clearer about what's expected of them and the risks that are associated, and really appreciate that this is a precautionary measure. We are trying very hard to look after our communities.
Thank you, Councillor Rye. Anna, are you able to come in with any closing messages on a public health perspective you'd want residents to be aware of?
Yeah, thank you, Kieran. Just wanted to say a big thank you to everybody who's joined us this evening, watching this on YouTube. Really do appreciate your support with this initiative and your understanding, working this out as quickly as possible and trying to be as clear as possible. So this session will have given you some of that information to understand what's happening, hopefully give some reassurance to everybody. I know it's a difficult time at the moment for everybody, lockdown, again, feeling like a very long January and February, but really don't want anybody to feel additional concerns about this. All we're asking you to do on top of everything normally is just to please get a test either through the testing site or wait at home for one to be delivered. Everything else goes ahead as normally, so please do carry on staying at home under those national lockdown restrictions. Look after yourself and your communities. And really do, I think importantly as well, if you get an invite for vaccination, please do take it up. It's incredibly important to protect yourself, your families and the local communities. Thank you.
Councillor Bell.
Thank you, Kieran. And can I echo those thanks to everybody who's given us their time tonight to find out more about what is happening, and also put on record my thanks to all our NHS and public health colleagues and our communications workers, our IT people, council workers who've really been working flat out since we got this information at the latter end of last week. And so given that we are kind of doing this at pace and with also kind of limitations sometimes on the resources that we're getting from the centre, to bear with us. So, you know, around the issues of capacity for people to get tests at the Dean Gardens site, it's been something that we've been working on to get greater capacity. We hopefully will get increased capacity, and what people should do if they've not got a test is kind of check in the morning and see if there are any additional slots that become available. We're trying to increase the capacity, and therefore that may be an option. If not, though, just be patient and wait for the teams to get the tests to your home. And, you know, we'll be absolutely clear that the people bringing those tests are council employees. They'll have ID. We don't want any of our elderly being worried, and we don't want them to fall foul to any unscrupulous people who might try to perpetrate scams. The tests are free. And also just one quick final thing, don't post the home testing kits. They're generic, and because they're the generic ones that are normally used in other situations, you would post them. Do not post them, because we need to collect them to make sure that they go to the right testing lab where we can check for the South Africa variant. So that's the purpose of the collection. But again, as Anna has said, as our public health director, please get a test. Also, when it's your turn, get a vaccine. Let's support each other through this, what is a difficult period. And I know that Ealing has come together in a fantastic way over the last year. Everybody is pulled together, and we need to do that yet again. And I'm sure that people will rise to the occasion. So a huge thank you to everybody who's doing what they can to keep us safe and to protect the NHS and save lives.
Thank you, Councillor Bell. Thank you to all of our panel, the Chief Executive, Councillor Bell, Councillor Rye, Anna, our Director of Public Health, and Deborah Turbett from Public Health England. Thank you to Dr. Palmer and other health colleagues who've joined us this evening and for their work. As Councillor Bell said, this is a fast-moving situation. From the Council's perspective, you will always find the most up-to-date information on our website, including FAQs. I apologise that inevitably we haven't been able to address every question that's been posted, but I would encourage you to check in there regularly on the website and our social media channels, which signpost to that information, which is updated as we go, to make sure you and others have the latest information. Thank you very much for attending. Have a good evening and